Good evening, everyone. My name is Connor Moran, and I'm the director of the Wisconsin Book Festival. Welcome to the 2021 Fall Celebration. We are joined by Dr. Leana Wen, who will be in conversation with Kate Archer-Kent this evening for Dr. Wen's book, Lifelines. The working title of this book was Public Health Saved Your Life Today. We're going to hear a lot about how public health saved our life today and yesterday and every day going back as far as we can remember. I am so delighted to be hosting Dr. Wen, and I'm so delighted that we have been able to have more than 100 free cultural events put on by the Wisconsin Book Festival since the beginning of the pandemic. We have 4 events for you tonight. We have 4 virtual events for you tomorrow. And then on Saturday, we have a full day, 10:30 a.m., wrapping up at 10 o'clock p.m. of in-person events at Madison Central Library. I hope that you will either, if you're watching at home, come to another virtual event today, tomorrow, or Sunday, or come see us at Central Library on Saturday. It's going to be a really special day, and we're quite excited to put it on for everyone. Dr. Wen, thank you so much for joining us. Thank you so much for writing this book. And Kate, thank you for joining us from Wisconsin Public Radio offices today. Kate will be our moderator. I will step away, and I will see everyone at the end. Thank you so much, and I'll leave it to you.
Well, I just want to say it is such an honor to be able to interview you, Dr. Wen. And in Lifelines, I really learned so much about the inner workings of public health and things that I frankly just totally took for granted. And I was also really moved by your experience, your coming of age as an immigrant from Shanghai to Logan, Utah. I did the math on that, and you could fit 520 Logan, Utahs into Shanghai if you look at population estimates today. I look at my 7-year-old twins and think, how would they do just being thrust into a new country, no language, to have all that they have is just on their back. That was very moving, and I think we're going to learn a lot from you with takeaways to how to improve the health of our communities. And thank you so much. I really appreciate it.
Well, thank you, Kate, for the opportunity to have this conversation. And Connor, thank you also for the invitation. I hope that at some point in the near future, we'll be able to do this in person, but happy to be having this conversation in a COVID-safe way in the meantime.
Well, let's start with the wake-up call that every community is experiencing, that once invisible work of public health becoming so glaringly visible in the pandemic. And what has, I wonder, the last 590 days of this pandemic revealed about how we treat public health in America?
Well, Connor mentioned the working title for the book, the previous title I should mention, which is this quote that we often use in public health, which is that public health saved your life today, you just don't know it. The idea is that public health is by definition about prevention. We are successful when we have prevented something from occurring, and therefore there's no face of it. But the problem, though, is when you can't see something, you don't appreciate it. And then when it comes to budget time, it becomes the first thing on the chopping block, because unlike police or education or something else that's really obvious and people understand the importance in their lives, if you don't see the work of public health, you don't fund it. And as a result, those who are the most vulnerable get further left behind. I mean, there is the face of a child who is tragically lead poisoned, but what about a child who could have gotten lead poisoned if not for the home remediation that was done? Or there's the face of a person who was shot, but what about the person who wouldn't have been in that place because they had additional educational opportunities that took them out of that setting, and they never experienced those tragic consequences. I think that I thought was the difficulty of public health prior to COVID. But I think COVID adds another dimension to this, because we all have seen the failures of public health writ large. I think if there's anything that's this last year has taught us, it's that we have seen what happens when you neglect and underfund and undervalue public health. But now I'm worried about something else. The New York Times did a report earlier this week that concluded that we are even less prepared for a future pandemic than we were at the beginning of this one. And that's because we have so many, they counted more than 500 top health officials who have been forced out or resigned from their jobs, in large part because of burnout, but also because of harassment and problems that they faced at work. We also have more than 100 state or 100 laws that have been passed by state legislatures to limit public health authority, which very much affects not only the ability to respond to COVID, but what happens if local health authorities can no longer do quarantine. And we have multi-drug resistant tuberculosis that's now here. What happens if there's another virus and there needs to be a mask mandate, and now masks have been so politicized that they're unable to be implemented? So I really worry that people now understand public health in some ways, but unfortunately it's been put in the middle of our culture wars and our partisan battles in a way that's extremely detrimental to the ability of all of us to survive in the future.
Well, along those lines, and we are a society that expects, that instant fix, the pill that just cures everything. And the pandemic has exposed how quickly we shift blame where there isn't an instant solution at hand. And I learned in your book that public health is this really long, slow journey of prevention work and all of these little wins along the way. And I'm wondering, can you give us a perspective on how public health works, taking like an intractable, just a really difficult problem and chipping away at it and getting some results, these little wins?
Yeah, so I'm a public health pragmatist, and if I may explain what I think that means, one of the things that I talk about in Lifelines is this parable, and this parable is used to explain what public health is all about. Although I have a different takeaway from this parable than perhaps it was initially intended. And so this parable is about going upstream. There are three friends who are walking along a river, and there's a current that's moving very quickly, and they begin to see that there are children in the river who are drowning. The first friend jumps in to try to save the kids, but can only save a few at a time, and there are many more kids floating by. The second friend goes further upstream, sees a dam, and starts to repair the dam. The third friend keeps on running, and the first two shout, "What are you doing? Come and help us." And the third friend says, "Well, I'm trying to see who's throwing in these kids in the first place." That's the concept of public health, is we need to see not just what happens when somebody is gravely ill and treat them, but also what are all these conditions that are making this person have poor health to begin with. I mean, I can tell you, working as an emergency physician, if I'm telling my patient who has cardiovascular disease and who has diabetes and high blood pressure to eat better foods, but she's telling me that she has to take 2 buses and then walk 10 blocks just to go to a Whole Foods, and then it's too expensive for her to afford. Or if I tell her to exercise, but she says it's too dangerous because she's afraid that she's going to get shot walking down her block. I mean, those other circumstances in people's lives also have a lot to do with their health as well. Here's my issue, and this is the parable obviously illustrates why the work of public health is so important. But I think that these days, especially in the recent few years, I worry that we've taken the parable too far. And what I mean is the following. I think that there are some things that we can do right now, short term, while long-term work is being done as well. I talk, for example, in Baltimore, in Lifelines, about the work that we did in Baltimore around the opioid crisis. That when I first started, I was first appointed to my job in December of 2014, and we were facing then, and are facing now, a crisis when it comes to overdoses from opioids. I started with what I thought was the intervention that was the lowest hanging fruit, that it was the easiest for us to get political capital and to and rally people behind, which was to talk about naloxone, get naloxone or Narcan, the opioid antidote, into everyone's hands so that people can save lives. I mean, there's no chance for a better tomorrow to get people into treatment if somebody is dying right now. I also thought it was the most politically palatable thing for us to be working on. Well, I was widely criticized for that program from some quarters who said, but you're only focusing on a short-term intervention. However, if we're not able to save someone's life right now, what is the point of trying to get them into treatment tomorrow? You can do both. And that's what I argue too, that while we work on these longer term interventions and look at issues that are hard, including structural racism in our healthcare system and systemic inequities and the policies of redlining that have gotten us to where we are with food deserts. I mean, these are major issues and we have to address them. We have to give voice to them. We have to talk about racism as a public health issue. I mean, all these things, yes, but that should not stop us from taking the short-term actions right now in order to make a difference too. There's a role for the person trying to fix the dam. There's a role for the person trying to save people's lives as they are floating by. Well, at the same time, we also need to stop throwing in children in the first place.
The things you say about the opioid epidemic, it just hits home here in Wisconsin. I mean, it is ravaging here. Drug overdose deaths soared to record levels in our state last year. And when you took over as Baltimore's health commissioner, you had a city where every household, nearly every household, was touched by addiction. And I'm wondering, what are those, important first steps that communities can take to address this crisis, the opioid crisis?
Yeah. It's such a good question. And when I first started in my role in Baltimore, I embarked on a listening tour because I wanted to understand what are the most important issues that our residents were identifying, because they don't necessarily match with the top health crises as identified by what's killing residents in our city. I mean, what the top killers until COVID came along were cardiovascular disease and strokes and cancer. But is that actually what people are thinking about when it comes to what's most important to them? And over again, I heard the same one issue being identified by virtually everyone. And I'll even explain to you the moment when it really clicked was I went to a meeting of young people. It was a youth group. And these were, 8-year-olds and 10-year-olds were attending. And I asked them, what are the health issues that they're thinking about? And I thought, hey, maybe they'll ask some questions about STIs, or maybe they'll ask questions about smoking or something, because the nickname of the Baltimore City Health Department at the time was the Department of Drugs, Bugs, and Sex. And so I thought, maybe somebody's going to ask a question about that. But actually, what they ended up asking about and what they all talked about was something so deep and profound and really heartbreaking. Because one child was telling me about how he was the only one who wakes up in the morning to go to school, because everyone else is addicted to various drugs and alcohol, and nobody else is getting up. He sees himself out in every day. Another child, because they had heard about the programs that I was running on naloxone, we were talking about what it looks like when somebody is overdosing. And I initially thought, oh my goodness, this is a very grown-up conversation. Should we even be talking about this? But a child brought this up. And I asked this question to this group: how many of you have seen someone who has overdosed? Everyone raised their hands. And they talked about what they've done in these situations, as in they would use ice packs, or they would try to, shake someone really hard, or they would call their neighbor, or, these were, again, 8, 9, 10-year-olds were telling me about how they tried to save a relative's life. Addiction, overdose tied into every aspect of our city. And so to your question of how do you begin to address this? Again, I really believe in short-term as well as long-term actions. And so what we did back in 2015 was pass legislation in our state that enabled me, as the health commissioner in Baltimore, to prescribe naloxone or Narcan to every resident in our city. Essentially, I issued a blanket prescription for naloxone to every one of our 620,000 residents.
And you printed prescription pads with signatures on them.
Exactly. And so it was a little bit of a frightening experience to write your NPI, your provider ID on 620,000 prescriptions. But we were also trying to make a point, which is that this is a really easy medication to use. We have seen people use them, outreach workers using them all the time. It's not just paramedics and police officers who should be using them. It's your friend, your neighbor. You have access to the ability to save someone's life. We also then began changing. That helped us to change the narrative around addiction somehow being a moral failing. and we begin to talk about addiction as a disease. That was the longer term action, as well as we started what was to become the first of its type 24/7 ER for addiction and mental health in our city. So those were the types of things that we did, and I think can be done and are being done around the country.
You weave your personal story into this book, and I really would like it if you could travel back in time to your story of coming to the US at age 7 with less than $40. And I was really moved that your you had slips of English phrases in your pockets to take care of your father who was sick. How did you go from Shanghai to Logan, Utah?
Yeah, so my mother came first as a student. It was very difficult in those days to immigrate from China, and so one of the only ways was as a was to study. And so she was already a professor in China, but came to the U.S. in order to get a PhD. You had mentioned that we came to Logan, Utah, which was another interesting story because my mother was given two options. She got into two places for a PhD. She got into Utah State University in Logan, Utah, and she also got into the University of Illinois in Chicago. Now, these are the days pre-Google and whatever ability to find information that we have now. This is 1990, and so she went to a trusted source. She went to a professor who said to her, "Oh, if you have the choice between Logan and Chicago, Logan is definitely the place to be." And so this was how she ended up in Utah. And then my father and I came shortly thereafter. The problem, though, was my father, as you alluded to, got very ill. He had a bleeding ulcer. And we had already bought our plane tickets. It was hard for us to get visas. My parents were political dissidents, in particular my father. And so we didn't know if we would be able to extend the visa, pay to get our tickets changed. And so essentially he left the hospital and we got on this plane for the longest flight that we had ever taken or had ever imagined taking. And he didn't speak English. I didn't speak English. I was really terrified that something was going to happen to my father mid-flight. And I also didn't know on the other end, how were we going to connect with my mother? I mean, just there were all these things that, again, nowadays, I feel like we can at least talk to people who've done this before, go on a website, and there are forums for people who can say, oh, this is what this airport looks like. We really didn't know how literally this was going to happen. And so my grandfather, who did speak English, helped at that time to write on pieces of paper all the different scenarios that could happen in Chinese, which I read, and I would flip to the other side or point to that piece of paper if something happened, including if something happened to my father and he had a medical emergency, or if we couldn't find my mother on the other side, what would we do? And actually, it's interesting because prior to us coming on, we were talking with Connor about the genesis of this book, and I actually had not at all intended for this book to be a memoir of my life. I wanted to focus this book initially on, and I actually wrote the draft of my book way before COVID. And it was entirely on my experience leading Baltimore's health department. I wanted to share the work that we did around opioids, treating racism as a health issue, what we did to reduce infant mortality in our city by 38% in 7 years. I thought there was a lot to tell there about the stories of public health. I submitted it to my editor, and she basically, and the publisher basically said, "You're asking people to eat vegetables, and you're not making a good case for why they should care about eating the vegetables." Which is, not exactly what every author wants to hear. However, important. It was an important lesson.
Too much spinach in there, Dr. Wen. Just too much spinach.
Exactly. It's like my trying to feed spinach to my son. Maybe hide it in a sandwich, and he won't know that it's spinach. Was essentially what my editor was saying. But I mean, she said to me, "Look, can you write? What about your own story? Can you dig deeper and see, does your own story tied to public health in some way?" And that's when I began writing about my upbringing, my coming to America, and Kate, what you mentioned about us coming to the US with $40 to our name. I mean, we then depended on many public services. I went to public school throughout, including college. I am my mother, when she was pregnant with my younger sister, depended on WIC. We were, there were so many other instances where we depended on the public health safety net. And I ended up putting that in the story as well, that I hope makes it less like I'm just making people eat a lot of spinach.
In stories of immigration, the part I find so difficult to stomach is when border officials assign you a name. And I can only imagine a piece of you dies inside when they decide that your name will be Lena, or your mom Ying becomes Sandy, and your dad Xiao Lu is Louis. Can you put into words how it feels to be given a name?
Kate, I will give you a different viewpoint on this, recognizing that this is every immigrant story and perspective is different. And so I by no means am trying to speak for other people in this. I'm just saying this is how we felt. I was so happy. My family, we were so happy to be given a name. And actually, my Chinese name is Lin Yan. And in China, my grandfather and my mother, both of whom spoke English, said, Lin Yan sounds like the English name Linda. How about when they ask you what name you want, you say Linda? So I said Linda. But either it was something with my pronunciation or with the word that the immigration authority heard, but he wrote down Lena in the way that it's spelled now, which is Leana, and is a constant problem in my life because people pronounce Leana or Leana. I'm like, no, silent A, courtesy of U.S. immigration. That part I don't like so much because I don't like the mispronunciation of my name that is not attributed to me. But at the same time, my parents and I, we wanted more than anything when we came to the U.S. to fit in. This was our country. I mean, we left China and we were able to stay in the US on political asylum. We had no desire to go back to China. We had no desire to maintain that identity. We wanted to be American. And so to come to this country, have people who were officials give us a new identity that made us feel like it helped us to belong more, that was really important. I remember that moment and I was glad for it. I remember when we took our citizenship exam, it was a very proud moment. These, again, I am certain that other people react differently when it comes to their names, and in no way do I take away from that. I would just say that for my family, we were really gratified and very, very thankful.
Wow, that's remarkable. I want to touch on, as a fifth grader, you watched a third grader, Tony, die from an asthma attack. You have struggled with asthma as well. What did that really horrible incident imprint on your mind about privilege and about what you wanted to do in life?
Yeah, I began Lifelines by sharing the story of how when I was about 10 years old, there was a neighbor boy who lived in my same apartment block, and I would often walk with him to our school together. He was just a couple years younger than me, 7 or 8 at the time. He had asthma, and I did too. And so I understood that feeling of when you're having an asthma attack and you can take a breath in, but you can't fully exhale. And then you take another deep breath in, but you still can't fully exhale. And so it's a terrifying feeling when you don't know if your next breath is going to come. But I also knew from having asthma that there was treatment. I mean, I'd been hospitalized many times in China for asthma. In the US, I still struggled with asthma. So I knew there was a treatment for it. And I could see his grandmother was calling for help. I came in. I mean, I see this as if it were yesterday. I saw him in a chair. He was really struggling to breathe, hunched over. I mean, just in this position that I knew very well of this just was not working. I saw that there was an empty inhaler next to him. I tried to give him my inhaler. He wasn't even able to really benefit from that inhaler. And I asked his grandmother to call for help. She couldn't. She thought that if she called 911 and the ambulance were to come, that the immigration authorities might come instead. And that the family, because they were undocumented, would be deported. By the time she called for help, it was too late. And he had died in front of me of something that I understood so personally as a preventable ailment. I got this very strong sense at that time, at that age, that in this country, we don't value people the same way, and that we do not see healthcare or health even more broadly, as I learned later on, to be a fundamental human right, as it should be. That was a major reason for why I wanted to become an emergency physician in particular, because I never wanted to be in a position where I ever had to turn someone away because of their ability to pay, because of who they came from, because of the type of insurance they may have had. I did not, I wanted to help to serve the people in the communities that I came from.
When your mother had your sister Angela, she sent her immediately back to China at 3 weeks old, and then your mother going right back to work after having a C-section. What can you say about that painful time and how it reflects on healthcare in America?
I was 11 at the time. Um, I had also blocked out a lot of these memories in my mind, and I felt actually so, what's the right word? I was so sad to reflect on these on these times, because at that time when I was 11, I didn't have really the consciousness of empathizing with my mother and really understanding what she was going through. I remember being very upset personally that my little sister was going away. I mean, it was such a selfish way of thinking about it. I suppose in retrospect, yes, I was 11, but I feel badly that I was not more kind towards my mother, because the decision that she must have made, what must have been going through her mind to have my sister go and live with my grandmother in China. I mean, I have two little kids now. I have a son who's 4 and a daughter who's 1.5, my own pandemic baby. Um, I cannot imagine saying goodbye to them when they were 3 weeks old, sending them, yes, to my relatives, but not knowing when I would see them again. And these were the days before Skype and FaceTime. We talked to my sister maybe a handful of times in the 3 years and some that she was gone. When she came back to us as a toddler, obviously she was a very different person, and my mother never got to see her between the time that she was 3 weeks old and 3.5. I mean, I cannot imagine that now. And so I think back to how difficult that must have been for my mother to make this decision. But also the point that you made. I mean, my mother, I remember at the time, and again, I had just not had this in my memory until I began writing this book. I remember the pain that she was in when she had to go back to work. She was working part-time at a video store where she was on her feet. And this was with a boss who at the time was very unkind to her. She didn't even tell him until very late in her pregnancy that she was pregnant, because she was afraid of getting fired. She was wearing these big sweaters that my father had so that she could hide her pregnancy. And then she went immediately back to work and was on her feet the whole day, when clearly she was physically not able to do that. And I think now to how many other women, how many people are in this position now, and what kind of society we are, that we say that we're pro-children, we're pro-family, we're pro-women, but what kind of society are we that we don't have paid family leave? What kind of society are we that we still don't have healthcare as a human right?
And you honored your mother's wishes as she fought cancer. You were there for those chemo treatments and really saw firsthand the suffering that goes on in cancer. Um, just reading how she had done all that work of putting her life in order, executing, a will and her last wishes. And can you put into words what it was like to honor her last wishes and carry that out for her?
My mother was diagnosed with metastatic breast cancer when she was 44. Um, and she ended up passing away. She fought her cancer for 8 years and then passed away. And she's been gone now for more than 11 years. Towards the end of her life, so she had gone through many rounds of chemotherapy and radiation. She was initially told on her diagnosis that she had 6 months to live, and then she ended up living 8 years. And she was in remission during multiple points, and we thought that the worst was behind us and that her cancer would come back. And at some point, she decided that she didn't want to fight anymore. It was very hard for me to hear that because she was still very young. My sister at the time that my mother died was 16. And so it was very hard for us as a family to hear what she had to say. When my mother decided to enter hospice care, it was very hard because we understood that it meant she wasn't going to go through more rounds of treatment. And then it was a very limited time for her to live. She was very clear, though, in her wishes. I think because she knew that it would be so hard for us to understand that. She was so clear to the point that she went to an attorney, wrote out a will, had it translated into Chinese, made sure that my father and I and her sister, that we all had copies of the will. She enrolled herself in hospice care. I mean, it was extremely clear what her wishes were. And she talked to me and to my father extensively about this, and to my sister too. But there was a moment when she was really struggling to breathe. She had a diagnosis of pneumonia, and she was being treated for her pneumonia. One day she really struggled to breathe, and my father, as so many relatives do, panicked and called 911, which meant that ended her hospice wishes, and she was brought to the emergency department. I was a resident at that time. I was doing my medical training in Boston. I ended up flying to California. At that very moment, she was about to be intubated and put on a ventilator, which was completely not what she wanted at all, which was what my 16-year-old sister was trying to say. No one was listening to her. My father doesn't really speak English and also was in such a state of fear and panic. And again, who wouldn't be in that situation? And I tried to say to the doctors, this is not what she wants. I mean, she has a DNI. She was in hospice care until 12 hours ago. This was extremely clear what her wishes were. And people turned to me and basically said, well, do you want your mother to die? I mean, what are you doing? I mean, she's so young. Why would you do this? And it was the hardest decision that I've ever had to make, of continuing with following her wishes. Even though it was so clear, there was no ambiguity as to what she wanted. I do not regret that decision. I regret not having my mother. Every time I think to my children, my mother ended up in the US becoming a grade school teacher. She taught second grade. She loved kids. Every milestone that passes in my children's lives, I think about how my mother would have wanted to be there for her or for my kids. I think about my sisters and the milestones that she's had. I mean, my sister went to college. She graduated from college. She was a Peace Corps volunteer. Now she's working. She decided to enter the world of tech, and she's now working in tech. And how proud my mother would have been of her. But I do not regret at all following through with the decision that she made about her medical care.
Let's turn back to COVID for a moment. Your family has gone through COVID. What advice do you have for caring for sick loved ones with this disease?
Unfortunately, this is something that so many families have gone through in different ways during this pandemic. I mean, we have now lost more than 700,000 Americans. There are millions of people who have become ill. I experienced this myself back in early December, prior to vaccines being widely available, when my husband came down with COVID. We still don't know exactly where he contracted this from. It remains a mystery, just as I think for many people, they take a lot of precautions, but we still don't know where this came from. And before we were able to properly diagnose him, because at the time testing was also hard to come by, we found out that our children were starting to have symptoms as well. Now, thankfully, everybody recovered without, as far as I'm aware, any long-term consequences. But I think it's just one of the things that had occurred during that same time period was I was a participant in a vaccine trial. in a vaccine clinical trial. I was in the Johnson & Johnson clinical trial. I had gotten the vaccine or the placebo. I didn't know which one. I had a 50-50 chance of getting either. And I had to make a decision about, should I take care of my family or should I basically fend for myself? And there was no, just because I had tested negative, but there was no decision to be made in that. And I think that's the same decision that all of us would make too. I mean, so many women, but so many caregivers would make about, we have to take care of other people around us. And so, now I think that situation is very different compared to December of last year. By the way, it turned out that I got the placebo all along. I thought, hey, I have a 50-50 chance of actually being vaccinated and protected. But it turns out that I got the placebo, although magically I never got COVID in that time period. But we are in a very different place than we were last time. I think the most important thing, of course, is vaccination. I do think that, having all of us who are able to be vaccinated helps to protect everybody else around us. Having widespread available testing, also really important too. But that's something that I would just advise people to stock up on. Testing, depending on where you are in the country, may not be so easy to come by. And if you are in a pharmacy, you see that there are some testing kits available, I would just advise to buy at least enough for every member of your family to take a test, if necessary.
Science and the CDC has come under attack. We saw it in the Trump administration, especially early on in the pandemic. Under the Biden administration, what do you see has changed, or how do you see trust now in the CDC and in how the public health at the federal level is approaching this?
Yeah, it's a great question, and I'm going to give you a nuanced answer. Part of the answer is obvious in the sense that I think the Biden administration has done a great job in terms of elevating the role of its scientists. I very much trust, and I've been following along all the FDA and CDC meetings where the advisors very thoughtfully go through all the reams of data and the hundreds of scientific studies that go into their decisions. I feel very confident about the decisions that our regulatory agencies are making. I'm confident that there's no political interference, that we're not having the White House or politicians somehow go back and edit data or take out or force the hand of health officials and make them say things that are not true. I think that's all really good. But I also want to add a caveat, which is that getting the science right is not enough when it comes to public health. Public health depends on gaining and maintaining public trust. When that public trust is eroded, it's really difficult to get back. And even if it's not your fault that it's eroded, that's still something you have to contend with. That's the first part. And the second part of this is there is a limitation also to the phrase follow the science. This is something I think the Biden administration could actually do a better job of, because just saying follow the science is not sufficient when the science is not what's at stake or what's in contention, I should say. But rather, everybody could agree on the science, but you could still come to a different conclusion because it's about values. So I wrote a number of Washington Post columns touching on this topic, but let me give you this example that's very topical right now, which is around boosters. There are scientists who fall into two camps. All great scientists and health officials and doctors who are all very well-meaning, who are very much all following the science. But some people think that we need boosters for everyone. Some people think that only the high-risk people need boosters. Where's the disconnect? Well, it's not because they're disagreeing on the science. Actually, the science is clear that immunity to COVID-19 wanes over time. When it comes to symptomatic disease, the protection against hospitalization and death still remains strong, especially in younger individuals. Among older individuals, I think everybody agrees they need boosters, but younger individuals below a certain age, let's say 50 or 40 or some other age, at least the protection against hospitalization remains strong, although symptomatic disease starts pretty dramatically declining. Some people will say, as long as I don't need to be hospitalized or I'm not going to die from COVID, that's fine. I don't need to get a booster. There are other people who will say, who are you to tell me that I shouldn't care about getting mildly ill? Because something short of a hospitalization could still put me out of work. And what if I'm the sole breadwinner in my family and I could risk losing my job? What happens if I'm a single parent and I can't care for my kids during that time if I'm really ill? What if they're young kids who are not yet eligible to be vaccinated? I don't want to transmit COVID to my family. What about long haul COVID that could happen with mild symptoms too? And so I make this point because the science is the same. But there are two groups that really differ on the interpretation of that science because it's about values. And I think the Biden administration, in saying following the science, but then having lots of scientists disagree with one another, makes it, some people could take away from that there's something wrong with the science. That, oh, health officials in this realm of vaccine, in this era of vaccine disinformation, some people could say, well, scientists don't know what they're talking about anyway. They disagree. I think the Biden administration is well within their rights to say, this is not about the science. This is about values. And we, as the administration, are listening to the American people who are very resoundingly saying that we care about getting any symptomatic illness at all. Therefore, we should be allowing boosters for everyone.
There's this mantra that you recite that you think public health officials should follow in a public health emergency: be first, be right, be credible. Has the US failed that mantra as we battle the pandemic?
Yes, we have failed in this regard. Some of that can be attributed to the prior administration and to muzzling of our scientists, not allowing them to speak. And therefore, they're not able to be right or credible or first or really do any of these things if they're not able to speak at all. And I think this is one of the reasons why you see so many other public health experts who are not currently in government stepping up, because we don't have those same constraints that are placed upon us as people within the administration does. That's clearly one of the issues. Another issue is, from the very beginning, we did not have testing. We didn't know how much disease was actually out there. We ended up probably closing down too much in certain places that didn't have a lot of disease, but we didn't know what we didn't know. And so we couldn't know that those places didn't actually have COVID. And so there was this national lockdown when it could have been a lot more targeted. And I think lockdown also is something that's a strategy that can only be used so many times. And if you keep on using it and nothing really happens, it's the boy who cried wolf. I fear that we have played that card already and can't do it anymore, which is a significant problem, not only for COVID, but for other things. I mentioned testing because I don't think we've learned our lesson here. We still don't have the level of testing in this country that we need in order to get out of this pandemic. It's kind of unbelievable to me that we're in a situation that other countries are not in. In the UK, families can get free tests from the government twice a week if they want. We cannot have that. I mean, I just went to my local pharmacy and the tests are $60 for 2 tests. I mean, that is not a reasonable sum to be paying for testing for anyone. And so I think we have not learned that lesson, along with many other lessons, unfortunately.
Well, I'm going to open it up here to questions. I'm opening up the chat here right now. Let's see here. I'm not sure if I see anything at the moment, but Connor, oh, here we go. Do you think COVID has created more respect for public health work or less? How do you feel public health workers are being regarded now?
It's a great question. And I think that, as with so much in this pandemic, it depends on what part of the country you're in. I was saying this to a friend the other day, just as a comment as we were having dinner outdoors. We were in downtown Bethesda, and we were talking about this particular topic. And I was saying, if Tony Fauci were to walk down the street of downtown Bethesda, Maryland right now, he would get a standing ovation. I would imagine that if he were to walk to downtown Madison, Wisconsin, that he might have a standing ovation as well. But I went to medical school in St. Louis. If he were to walk down the street of Branson, Missouri, I don't think that Tony Fauci is going to get a standing ovation. I would hesitate to think about what could happen in that case. And this is, people tend to trust their local health officials more than federal health officials. So I'm being a little bit flippant here, but only to say that in many parts of the country, people appreciate the work of public health in a way that they never did before. People may not have ever known who is their local health officer, that there's a city and county health officer in their areas. Who are these people and what do they do every day? I mean, I think there's a recognition and appreciation in many places. But on the other hand, there is very much the opposite as well, that public health has, I think in many parts of the country, there are public health workers who have been threatened, who have been boycotted and targeted outside their homes or their kids' schools, just for doing their job. And so I definitely think that this goes both ways, tragically.
Another question here from the audience. When do you think that the Moderna and the J&J recipients will actually be able to get the boosters once they are presumably approved today? And I think I just saw a push that they
Yes.
are approved. So what are your thoughts there on the timeline, the time frame?
Okay, so while we've been having this wonderful conversation, Kate, the breaking news is that the CDC advisory panel has agreed with the FDA in allowing for Moderna boosters for the same group that was already eligible for the Pfizer boosters. So Moderna mirrors Pfizer, and then also for people who got the J&J vaccine, to essentially everyone who got a J&J vaccine, regardless of risk factor, needs a second dose of a vaccine. It could be J&J, it could be Moderna or Pfizer. So that just happened. The CDC director has to agree with those recommendations. And so the CDC technically, I know this is kind of a lot, but the advisors just approved this, but the CDC has not. They probably will, I would imagine. Could be later tonight, it could be tomorrow. I would hope that it is this week, so that by this weekend, maybe even tomorrow, pharmacies are going to be able to give boosters out. Now, that is all going to depend on your local pharmacy. There are some pharmacies that are already giving boosters to these groups, anticipating that the CDC was going to give this guidance because the FDA came out with their guidance last night. And so some places are already doing it. Other places, it just maybe takes more time for them to get the information, to have their protocol set up. So I would say if you are in this category of a Moderna recipient who's at least 6 months out from getting a Moderna booster, or a J&J recipient at least 2 months out from getting your J&J dose, you should call your local pharmacy, ask them what their protocols are. You may consider calling several different pharmacies in your area if you have the ability to drive easily to those pharmacies, because it's possible that one place may not have their protocols in place, but another might.
Another question here coming in. We often hear about the polio vaccine as an example of a public health success. Are there more recent or more modern successes that we don't know about, or maybe which haven't been touted as much as it should be?
It's a really good question. I mean, this is the whole reason why I wrote Lifelines, or at least the initial reason for writing it, until it became more of a memoir and less just of let me talk about the successes of public health. But I mean, there's so much, and actually, one of the things about public health that I don't want us to lose sight of in the time of COVID is that public health does not equate infection control. Infection control is an important part of public health. And yes, the polio eradication campaign and smallpox eradication, all those have a lot to do with the successes in public health. But public health is also about setting up food access programs so that we're able to reduce the impact of food deserts. Public health is also home visitation programs that assist new moms, new parents with cribs and teaching about safe sleep practices. It's also about home remediation to prevent lead poisoning. I mean, there's so much more in the realm of public health that have made tremendous differences over the years and that are very local in scope. And so I hope that we'll really, going forward, really uplift the stories and the experiences of local health departments and community health groups that are doing this incredible work.
Do you see a role for a broader public health initiative post-pandemic for the mental health issues that have emerged among kids, among healthcare workers on the front lines, all of these frontline workers? What are the mental health implications here?
It's a really good question. If it's one, maybe a silver lining coming out of the pandemic, it's that there is a lot more recognition and normalization of mental health. I've talked to my colleagues in university administration who have said that it just feels like, for example, in the worlds that they're in, a sea change when it comes to checking in with faculty, checking in with students. I've talked to employers who are focused on mental health and the mental health needs of their workforce in a way that they might not have before. Before, and still now to some extent, you get a different treatment if you say, I was just diagnosed with diabetes versus I was just diagnosed with depression. But really, we should be treating them the same way. Actually, one of the stories I shared in Lifelines is about how I had postpartum depression after the birth of my son 4 years ago. And I didn't even recognize it. But then even after I recognized it, I was ashamed of seeking treatment. And I was running a program that oversaw health of pregnant and postpartum women in our city. I mean, it made no sense. But that was the degree of stigma that I felt shame of treatment for something that is a medical illness. Whereas if I were diagnosed with diabetes, I don't think that I would have felt the stigma of going to see an endocrinologist to manage my blood sugar. And so I do think that there's a lot more work for us to do, but telemedicine, recognition of mental health that's just as important as physical health. I think there is more of that, and the needs of our children, as the questioner mentioned, as well as frontline workers, I do think has been highlighted, and I hope will continue. For physicians, for so many years, doctors have not. When we fill in, and actually this is still the case now, when we fill out our medical license information, so many places will ask us about have you ever used substances? Have you ever been hospitalized for substance use or mental health? And with the implication that if you do, you might not get your medical license. I mean, that's not encouraging to anyone to seek treatment. And so we really need to do better, I think, as a community to look at those systems and structures that are in place that inadvertently stigmatize mental health in a different way than your medical license does not ask you, have you ever been treated for heart problems or stroke?
I want to follow up with another stigma. Millions of Americans have a stutter, including President Biden has a speech fluency disorder. You worried initially that your patients wouldn't accept you as a physician who stutters. How did you approach that? How did you attempt to hide your stutter? And what did that experience teach you?
Yeah, I so appreciate this question. And it was something that I spent quite a bit of time in the book talking about because it has so much to do with who I am. I grew up as what I know now to be a covert stutterer, meaning that most of the time I was able to hide my disfluency, but it was actually in hiding my disfluency that I was hiding my identity. And actually, so much of my mental energy was spent on trying to anticipate what I was going to say next. And if I were going to stutter on that word, I would try to find a substitution for it. And that mental gymnastics involved, actually, when I realized this and finally got treatment, I realized that I had so much space in my brain for other things, because otherwise I was always anticipating 2 sentences ahead. I mean, I would think, for example, going to lunch, I wouldn't order certain foods if I thought that I might sound disfluent in saying that word. Or I would try to get out of every opportunity to say my name, even to the point of leaving the room when introductions were made, because I was afraid that I would stutter on it. And so there were so many instances of my turning down opportunities or not pursuing them also because of this too. And so I wrote about this in Lifelines because it wasn't until my mid-20s that I sought help for my stuttering. I was a medical student at that time, and to your point, Kate, I didn't know if how what would happen with my patients. What if what and I didn't know, in organizations that I had a leadership role in, how they would react if they knew that I was a person who stutters. And so it was actually in accepting my identity that was the most difficult part, to accepting that I'm a person who stutters. And that has been such a great source of shame in my life. And facing that shame has made me much more aware, I think, of what else people may be carrying around them, that for them at some point in their life may have been a source of shame and fear and stigma, whether it's someone who may be addicted to drugs, or somebody experiencing homelessness, or somebody who came from a different country, or who was undocumented, or somebody with a different gender identity, or whatever that person's source of fear might be. That it's my job, just like I think for all of us, to treat everyone with dignity and compassion.
Dr. Wen, thank you so much. Appreciate it.
I so appreciate the opportunity to join you. Thank you so much.
I don't know, Connor, if you're going to step in here.
I am. Here I am. Thank you so much, Dr. Wen. I can't thank you enough for all of your expertise in all of these areas. I think that you're absolutely right that this is a major portion of what it takes to go into everyday society that we don't talk about enough. And I hope that, I know for many of the people watching at home, there were so many moments where they had kind of an aha moment, or where they said, that's something that doesn't get talked about. One person said in the chat, thank you for your story about your mother, and just the struggle that you had there. It's so relatable, and it's so important to talk about. And there's so many things, just the stuttering conversation there at the end, that are so important to talk about. And so thank you for this book. Kate, thank you for your lovely questions. As always, it is great to have you as a moderator. Please, if you want to see or hear from Kate more often, please listen to the morning show on the Ideas Network of Wisconsin Public Radio. You can find Dr. Wen's work all over Washington Post. Will you be on CNN later tonight, Dr. Wen? Will we see you? Maybe.
Anything is possible. It's live TV.
Yep, live TV. Thank you I'm so glad that we were able to have you on just as we got that information. That's one of the beautiful things about events like this. You do capture them in real time, and you can get amazing confluences of moments like that. Thank you to everyone watching at home. We had a lovely audience of more than 125 people. I hope that you will come back at 5:30. We will be here with Raya Hakakian for her book, A Beginner's Guide to America. This has been the first event of the 2021 Wisconsin Book Festival Fall Celebration. Thank you everyone for being here, and we'll see you soon.